You know, if you're heterosexual, were you just having rampant, unprotected sex? If you're a homosexual, well, it's because you're homosexual. If you're a drug user, then it's because, you know, coupled with the fact that now, not only am I wearing the stigma associated with having HIV AIDS, but I am being discriminated against by practitioners within the medical community, right? Which invariably results in a death sentence, right? I'm going to providers of health in order to make my life at least bearable, at least livable, and in addition to the stigma, I'm now facing acts of discrimination that only makes matters worse, right? So, some of the things that we can address in this discussion are the 3 categories of neglected diseases, right? This is very important, actually. The 3 categories, CETEGORIES, of neglected, right? Of which AIDS is one. Remember, as I said before, insofar as we're talking about healthcare and health provisions, I said it you know, in this sort of kumbaya, utopist, sort of naive world, then we all sort of just stroll into the medical complex and we are cured of our disease. We know that's not true, right? We know that the fact is, the more money you have, the better medical coverage you have, the longer your standard, the higher your standard of living, and probably the greater longevity you will have in life. You'll probably live a couple more years than the person who doesn't have access to adequate medical coverage and medical care. But let's look at some of the examples of neglected disease, which also include AIDS. What you'll recognize first are type 1 neglected diseases, TYPE, type 1. For example, hepatitis B, right? TIS, hepatitis B. And the communities that are affected, for example, by hepatitis B are both rich and poor, right? Both rich communities and poor communities alike are affected by hepatitis B, right? Rich and poor alike. Okay, let's go to type 2. Type 2. An example of type 2 would be HIV AIDS and tuberculosis, right? So we can talk about HIV AIDS and tuberculosis. All right? And the communities affected are both rich and poor alike, but, quote, and this is a quote now, but disproportionately present in poor communities. So both rich communities, communities of affluence, and poor communities are affected by hepatitis B. But when we're talking about HIV, AIDS, tuberculosis, rich and poor communities are affected, but poor communities are disproportionately represented as having higher instances of HIV, AIDS, tuberculosis than rich communities. So you can see now that the actual disease manifests and is transmitted, and the occurrence of the disease, the fact that people have the disease, is higher, disproportionately higher in poorer communities than richer communities, right? So that with respect to poorer communities, increase presence of the disease, right? PRESCENCE. Okay, and then number 3 are type 3. And type 3, an example would be sleeping sickness, river blindness. Alright, so let's write that down, like sleeping sickness, river blindness. And the disproportionality is overwhelming, right? Overwhelmingly, or even exclusively, those inflicted with these diseases are primarily poorer people, right? Poor communities, right? You're not going to find instances of river blindness or sleeping sickness in affluent communities. You're not, right? It's not to say that it cannot happen. We're all human beings. We're all sort of can contract the same diseases, but the ailment itself is is exacerbated by the impoverishment of individuals living within that community, right? So it's important to recognize that, yes, we are all entitled to equal medical treatment under the law, but we recognize that healthcare is not the right to health. The right to health is much larger, much broader than the right to health care. Specifically, however, we see that it's not just a right, but inherent within the system itself, and there needs to be tons more research done on this, both within the hard sort of physical sciences and also the social sciences, is to ask ourselves, I mean, there's answers that I can think of off the top of my head and answers that I've read, but more for up-and-coming new researchers. If you're interested in the relationship between human rights and health, it's very, very interesting to ask yourself, why is it the case that the disproportionality of, let's say, HIV AIDS is higher in populations where the communities are poorer? Why is it? Is it simply, and this is why I think what I do is so important, is it simply a lack of information? I think the overwhelming answer is yes, right? I think just the sheer lack of information and all of the fallacies. You can get AIDS from a mosquito bite, you can get AIDS from sitting on a toilet seat, you can get AIDS from shaking someone's hand, like the rampant misinformation, the rampant lack of information is one of the key reasons why individuals within poor communities probably have a higher instances of HIV AIDS contraction. If that's the case, then we just need to get the word out. The more the word is spread, the more people really understand exactly how the disease is communicated or passed to, I know it's communicable, but I don't know if it's communicated, I don't know what the technical scientific word is, transferred, disseminated to other human beings, is the better we are able to protect ourselves, right? The more realistic we are with the fact that teenagers actually do have sex, and that, you know, the distribution of condoms isn't so much, and now granted, I'm giving you a really liberal bias here, but you guys know, you've seen the tour of the office, you know I'm pretty left, I'm left of the left. But yeah, I mean, you know, teenagers are going to have sex. So rather than my personal belief, you know, talking about abstinence, which is not going to happen, talking about sexual education and making sure that your children are safe, I think there's, personally, I usually don't give that much bias in my lectures, but I think personally that does a bit of service, right? So the whole point is, if it's the case, it's not even if it's the case, since it's the case that both people of affluence, of wealth, have the same susceptibility to HIV AIDS as any other person in the world does. However, there is a disproportionality in representation within poorer communities than in more affluent communities. If it's the case that it's because of education that individuals within African communities aren't contracting HIV AIDS, then we need to get the word out. Then there needs to be more of this, right? So I think that's very, very important. Two more points and then we'll be done. The Delaware Declaration recognizes, quote, the gravity of the public health problems afflicting many developing and least developed countries, especially those resulting in HIV, AIDS, tuberculosis, malaria, and other epidemics, right? So there is a recognition at the international level of this disproportionality, and there is a recognition that developing nations, poor communities within developed nations, and poor people as such, have an incredible, difficult time when it comes to safeguarding their health rights. Not just healthcare, but their health rights. And there is an obligation, it is undeniable that there is an obligation that the government has to assume in order to meet those rights. Again, if there is a right, there's a corresponding obligation, and obviously our government is obligated to make sure that its population is not sick. But it's not just the negation, it's not just that it's not sick, but that its population has satisfied the sort of holistic approach of having both social well-being, mental well-being, and physical health well-being, right? So that the government is responsible for that. And how that manifests in the obligation is the basis of a ton of debate, right? Political sort of rhetoric goes crazy over the discussion of healthcare. I'm not a politician, so I don't really care about the political debate. All I'm saying is that it's undeniable that the government shares the responsibility. How that responsibility unfolds is for people more powerful than myself to make the final judgment, but we need to recognize that it is the case. The last thing, I'm actually not going to read it, but I just left it there for you, is the full preamble to the Universal Declaration of Human Rights. I encourage you to read it on your own. There's no need for me to read it here. It's in your notes. And that concludes my lecture series on human rights. So if you've watched all the videos and you spent the last 10 plus hours with me learning about human rights, you are far more knowledgeable about the role of human rights, the complications of the relationship between rights and duties, the role of global capitalism as a bad presence, as a potential good presence. You've learned about food rights, health rights, the rights not to be tortured, the role of denial. We've talked about a lot in this lecture series, and as I said, I've thoroughly enjoyed the series and the ease with which I delivered it, and I was able to actually build the lecture series sort of from scratch is going to encourage me to do another one sometime in the near future about the same length. So with that, I want to thank you for taking the time to watch my videos. I also want to thank you for taking the time to watch my series on human rights, and this officially concludes the Human Rights Lecture Series. With that, I'm Dr. Jason J. Campbell, and you have a great day.